Good evening, everyone. My name is Daniel Sforza. I'm the editor of the Bergen Record and NorthJersey.com. I'm coming to you from my home, not our newsroom where we would normally do a broadcast, because of what we've all been dealing with, the coronavirus outbreak, and because of how it's upended our lives. And we have changed our work habits, changed our social habits, changed our routines. Not something that is easy to do. We have a daily deluge of news that is not very uplifting. And even though that is the case, it's important that we pay attention. It's important that we ask questions. It's important that we understand what's going on so that we really do act out of facts and not fear. And so that we really approach our lives and the decisions we make based in objective reasoning and news that is not meant to scare, but meant to inform. For the past couple of weeks, our journalists at NorthJersey.com and the Record have been doing just that. We've been out there working sources, working the streets, going to press conferences, talking to people about the realities that are faced when such a pandemic occurs and how it changes lives. What we found in many cases is uplifting. In some cases, it's startling. In other cases, it's questionable. And we're working on all those angles to bring them to you. This is part of a series that we're going to be doing to answer your questions over the next few weeks. We've included other things as well. We have videos on our website, NorthJersey.com, called Long Story Short, that tackle specific topics. They're available in both English and Spanish. We also have set up a Facebook page that deals directly with questions about the North Jersey coronavirus. So please check that out. We're also working with small businesses in our area to do a series of stories about how they're open for business and how they're dealing with this. Small businesses, and every business, is really being impacted in horrible ways at this point. And many, though, are coming up with creative solutions, creative ways to keep their businesses going, to keep their employees employed during this time. So check out our small business Q&A. It'll be running daily on NorthJersey.com, called Open for Business. Tonight, we open our first Ask the Editors on Facebook Live. And again, we'll be doing this, every few days, once or twice a week, probably. Maybe from this lovely home studio we've created. And we'll try to bring in guests who have more expertise than I do to answer questions. But obviously, I can answer questions about our coverage and how we're approaching things. Tonight, we have two of those guests. One is our State House reporter, Ashley Balcerzak. She's been covering press conferences for the past couple of weeks. She knows the ins and outs of what's occurring throughout New Jersey and what is expected to occur. And she'll talk a little bit about that tonight. The other is a childhood friend of mine, JeanLuc Neptune, who is a medical doctor and an entrepreneur. And JeanLuc, a couple of days ago, learned that he had come down with COVID-19 and posted a very moving and, again, facts, not fear video on Facebook that he agreed to let us use on NorthJersey.com to get the word out about what it's like to contract the disease, deal with it, and work to come out the other side. So we'll be hearing from him as well. Now, at first, what I'd like to do is go to Ashley so we get the latest update of what we've heard today from the governor, from other officials, including Judith Persicelli, who's the state health official. And we've heard from Josh Gottheimer, one of the North Jersey representatives, and Jim Tedesco, one of the county executives out of Bergen. So Ashley, what did we learn today? What did we find out?
So they start off these press conferences talking about the number of positive cases. And today we're up to close to 900. We have 890. It's a 150 person spike. But they told us that that's probably pretty low, much less than they were expecting because of kind of how they batch the different cases. So they may actually update us tonight and we may see a bigger spike here. They've increased the capacity for testing. They started a new drive-through testing site at Bergen Community College today and had to shut down hours early because they hit capacity. They tested more than 600 people. They thought that they were only going to be able to do 200. So since we're seeing a rise in testing, we're going to see a rise in positive cases. So the health officials are saying expect in the thousands soon. Let's see what else. We also know that tomorrow there will be an announcement from the governor about new social distancing measures. So you may have seen that Andrew Cuomo, the governor of New York, has announced new measures and a lot of shelter-in-place orders everywhere. So the governor is going to most likely say non-essential businesses, you're going to have to shut down indefinitely. Now, what we need to learn is what is a non-essential business, what is an essential business, what is allowed to stay open, what is not. The governor has already shut down explicitly certain businesses and he's named them, but this seems like it's going to hopefully clear up a little bit of this confusion. He also may limit gatherings even further. Right now, he's saying don't be around 50 people. He said he may bring that to 10. He may bring that even lower than 10. So we're supposed to hear from him at noon tomorrow, and we can learn updates there. Did I the big things, or do you have other?
No. I think that's a really important point that you bring up, the confusion level, because this is moving so quickly, and state officials and local officials are acting so quickly that a lot of times the message that gets across to the public is not as clear as it could have been in terms of what it means in practicality to, say, shut down a mall or stay inside except when you go out for groceries, or shut down other various parts of society, or limit your gatherings to 50 people. For instance, who is responsible for counting the 50 people, and if you show up as a certain place, it all gets very confusing. And I think as this goes on further, some of that confusion will lessen. Is that your feeling as well?
I hope so. The way that it's appeared to me now is that they make an announcement, state officials make an announcement, readers come to us with questions, we ask them at the press conference, and then maybe they're addressed a couple days later. For instance, I got a lot of emails and calls from people who owned barbershops or hair salons saying, okay, I touch people for a living, like you didn't explicitly close me down, but what am I supposed to do? And then a couple days later, Murphy explicitly named them. So that's kind of how we've been seeing it right now. It just so much is happening, and they're having to deal with so many different factors here that I don't know how it'll be. We'll see. It's California, Pennsylvania, New York are making these decisions before, so maybe we'll be able to learn from some of the policies that they're passing today and yesterday. So we'll have to see.
In your time as a reporter, have you ever seen anything like this in terms of the frequency of press conferences, in terms of how people are adjusting to this and figuring out their schedules and what they're doing? I mean, it seems frenetic, I think, to a lot of the public. And explain a little bit about your perspective.
I mean, as a reporter, no, I've never covered anything like this. And that's one of the most difficult parts, is making sure that you understand everything that's going on. So I'm on my phone from the moment I wake up to the minute I go to bed, much later than normal, because I need to make sure that I know what's up to date, and that when I am then writing an article, I have all the most up-to-date information. So no, this is the craziest it's ever been for me personally.
Thank you, Ashley. I really appreciate that insight. And we'll stop back in a second as we get some more questions coming in. I think it's important, folks who are watching online, please submit your questions in the chat and we will get to them. Also, I think it's important to realize how hard, a little self-promotion here, how hard our journalists are working day in and day out to bring the news to you. Many of them are working 16 to 20-hour days. It's nonstop because the news is nonstop. And what we're trying to do is get through it as dispassionately and objectively as possible, oftentimes putting aside our own anxieties to make sure that we get you the information that you need to make decisions about your life and your family, your job, and how you're approaching your interactions with other people, and how you're going forward with all different types of issues that we're all suddenly now facing. One of the folks that is facing this head on is one of my oldest friends from our time in Teaneck together. His name is JeanLuc Neptune. He's an MD. He's also an entrepreneur. And JeanLuc came forward a couple of days ago with a video that he posted talking about his experience after learning that he had contracted COVID-19. So I welcome you tonight, JeanLuc.
Thanks, Dan. Good to see you.
So tell us a little bit about your journey here and how you wound up posting this video that our viewers are seeing now, and contracting the virus, and the steps that you took and what you've learned over the past week.
Sure. So, maybe I can talk about the course of my illness first. So, I originally came down with the symptoms that I have Tuesday, March 10th. So that's really when I fell ill. I'd been fine before then. As I mentioned in the video, I believe that I was informed that I had a confirmed exposure to a group of French healthcare executives, one of whom was positive for COVID-19. I learned about that just last Sunday. And basically, I think I was exposed on the 7th. Took probably about 4 days for my symptoms to develop. And then since that time, I've pretty much been stuck at home and have been recuperating for the most part. In the video, and I actually filmed part 2 to the video that I posted yesterday, I just talk a little bit about my symptoms and how things have progressed. It's been challenging to have a fever for 11 days, to be coughing a lot, although it's interesting, coughing is just one of the constellation of symptoms that comes along with this very strange disease. But I'm feeling better, I'm doing better. And other than a 3-hour nap today, that took me some time to get out of bed, I am feeling much better. And as you can tell, I'm talking here for a couple minutes without coughing, which is very encouraging to me, and I'm excited about that. I decided to film the video because I was getting the impression that there are people in various places who are not taking this seriously, and that there were people who are assuming that this is mild or this can be mild. And the interesting thing is, for many people, it is mild, right? For 20% of people who are infected with COVID will have no symptoms at all. But I think what a lot of people don't understand particularly people without medical training, without epidemiological training, is that for a certain significant percentage of the population, this disease can be very, very severe. I would call my case sort of a moderate case, definitely not mild, but definitely not severe. But I think, I really wanted people to understand that this can be very, very hard, and that you should start taking this seriously, and, encouraging your friends and family to take it seriously as well, and listen to state and federal health leaders in terms of what you should be doing to take care of yourself.
I think that's so important, these points that you're making, because you see so many instances of people still gathering or getting together, or saying, well, we're outside, we can still get together. And really the best defense that we're hearing from all the health professionals, such as yourself, and our state and local leaders, is to socially distance, keep apart from folks. Can you explain a little bit about why that strategy works from a medical perspective?
Sure. So, my training is in internal medicine, so I have some knowledge of this. A virus needs to be transmitted between people, and that virus generally is going to be transmitted between people because of things like your excretion. So, for instance, many viruses rely on somebody coughing or sneezing, and the virus being contained in the droplets that are associated with the sneeze or the cough. In part, that's why the mask can be very useful, is if somebody is coughing or sneezing, the mask can trap the viral particles in the mask. So, the idea with social distancing is that the fewer people that you're in contact with, the fewer opportunities you have to transmit the virus, right? If I'm sitting here by myself in my house, there's nobody that I can transmit the virus to, and that is the key thing. So, you know, when I was getting ready to film the video, I saw these spring breakers in South Florida, Daytona Beach or whatever. And
I think everyone's seen those.
Oh my God. I mean, and just thousands of kids. I was that kid when I was in college, you know, and totally understand, I think, their disappointment in not being able to do what they do. But if you could imagine that I'm sitting here by myself, I can't transmit the virus because the virus requires me to give it to somebody. Who knows what's happening down in South Florida? So really the goal here is to make it difficult for the virus to jump from one person to another. And then what that does is it slows the progression of the virus through the population. And again, the key thing that we're trying to do here is prevent the peak number of people so that we don't exceed the capacity of our healthcare system. If we can make it a long, smooth curve, this idea of flattening the curve, we can do a much better job of allowing our health professionals to have the resources they need to treat people.
I think it's so interesting, just from a perspective of the terms that the general public is not used to hearing: social distancing, flattening the curve. Now they've become part of the lexicon. People are talking about them all the time. They're, you know, talking about social distancing. They're talking about not overwhelming the hospitals, the flattening the curve. One of the things that I think is interesting as well is I think people should be aware, and correct me if I'm wrong, but this might not be one curve to flatten. You may flatten a big curve and then it may rear its head again and have to figure out another way to get at it. What are you hearing along those lines in terms of, is this something that we can knock out, or will it come back? It may be too tough to tell that right now, but any thoughts you might have could be interesting.
Sure, and I would just comment on just the first part about social distancing and flattening the curve. I mean, you know, those are very technical concepts, and I think for a lot of people who do not have very technical training, they can be hard to understand. That's why it's really difficult, I think, for people to, you know, ask, like, why is this random virus that's coming from China, why is it a risk to me, you know? And I think what our health leaders have to do is explain these terms or explain these concepts in the simplest way possible. And it's almost, you know, population level education 101 on medicine, on viruses, on epidemiology, and that's hard. But I think, you know, hopefully if we can get good, consistent messaging from the state and the feds, we can start to educate people and help them understand these concepts. In terms of the waves, I was reading, or I've heard alluded to a report from HHS that implies that this could be many, many months, maybe up to 18 months from what I heard. And again, heard from a couple different sources online, with multiple waves, right? Sort of an initial wave that peaks and then sort of goes quiet for a little bit, then comes back. And, you know, until we have a vaccine, and we can vaccinate people, and Dr. Fauci has said that a vaccine is, you know, 12 to 18 months away. It may be difficult to stop this. This is a little bit above my pay grade in terms of my expertise, but from what I understand, you know, I think the virus may come. You may have a big peak. It recedes, but it's still in the population. Then you have another wave that comes, and I think that might be the pattern that we see for some time.
Yeah, and I think it's important for folks to realize that these strategies, and particularly the hand washing and how you approach your daily life, this is not something that's going to end in 2 weeks or 3 weeks. It's something that we're going to, as a society, change in many ways from. You and I were discussing that, you know, before we came on air here, which is really interesting. And today you spoke about your testing. Today we saw over at Bergen Community College lines that extended 4 miles for people to get testing, and people with, you know, any symptom were allowed to show up, and they were screened, and if they had the combination of symptoms that are used to diagnose a possible COVID-19 case, then they were swabbed, and that specimen was sent off to a lab, and I believe they'll have their test results back in 2 to 5 days. I know that Ashley is still with us. I don't know, Ashley, if you have a estimate of when we'll start hearing the tests from what's happening at Bergen Community and what's going to happen at PNC Bank. on Monday. How quick is the turnaround there?
You were right. They said 2 to 5 days and are hoping to be quicker than that, but it's that range at this point.
We have a couple of questions in our chat as well. One of the questions is, are they planning to close down the parks? And this comes, you know, as people are getting tested and the warmer weather is coming, people are cooped up. They're looking to get outside. Are the parks closed? Has there been a statewide order to actually close the parks?
Right now, there's not a statewide order. We'll see tomorrow if that's included in there. In the last couple of days, I think somebody did actually ask about that, and Governor Murphy was saying, well, it's something that we kind of have to weigh, right? Because you're in your house, you're cooped up, you're stressed, you're anxious. Going outside, going for a walk is going to make you feel better. Work on your mental health as well. But he's saying, like, no matter what, at this point, 50. But again, it should be lower. The federal level is saying don't be around 10 people. If you're outside, don't be within six feet of someone. Don't be with a big group. Don't a ton of kids playing on a playground together or a huge picnic with a lot of people. That is frowned upon at this point. So we'll see if he lists parks tomorrow. It's a good question.
And I also think that it's interesting to note that there is a sense out there, and perhaps JL, you can speak to this, that the younger generations, folks in their teens or 20s, are immune to this or won't get a severe case of it. But it's so much more than that, because they can be really unwitting carriers of the disease and spread it around. Is that pretty much what you have heard, JeanLuc?
Yeah, I mean, so that's the big challenge, and that is again, a very subtle concept that I think people don't think about. People think about, I'm a young person. They think about how the virus will impact them, and if I'm not going to get sick, or if I'm unlikely to get sick, then I'm not going to worry about it so much. But the issue is, if you are sick, if you are infected, but you have no symptoms, you can be merrily walking around, going to see your parents or your grandparents or other people who may be vulnerable. And, it's remarkable how many people are living amongst us who have chronic medical conditions, who have suppressed immune systems, who take medications, who have lung issues. One of the beauties of our system is that our healthcare system is we're able to keep a lot of people alive who might not be able to stay alive because we have such great medicines and such great technology to keep them alive. But, if those people are now exposed to this virus because a young person went to see them, that's the risk. So again, part of why we're trying to tell young folks, don't get infected in the first place, even if you're not going to get sick. And then please, be careful around other people who may be vulnerable, who may be more sensitive to this, because they could get a lot sicker than you can.
Yeah, great points. Ashley, one of the things the governor has referenced repeatedly over the last week is talking to younger folks and saying, don't have, I think he refers to them as underground parties. And I have a sense of what he means by that, but he's basically saying, don't get together. Don't think that you're immune, because everything that JL just outlined could occur. We have a question in the chat about if people are doing this, if people are holding these gatherings, whether they're young or old, are there any penalties or fines, any sort of punitive measure that the state has put in place?
Yeah, so at the beginning, the state police superintendent was saying, okay, you'll be let off with a warning. But now the way that state officials are talking about it is saying, okay, no, we're going to crack down a little bit harder. We will charge this as a disorderly person's conduct. So it's unclear if that'll change tomorrow, but the governor has been meeting with police across the country, telling them, you need to break this up. You need to take this seriously. We are going to crack down on this. And just to go back to the young person point, just really quickly, we also just don't have a lot of data out there too. And we do see younger people also getting sick. So yeah, they can be carriers, but they can also be sick. Out of the 11 people that died in New Jersey due to coronavirus or COVID-19 complications, 2 of them were people in their 30s, which is much younger than what we were thinking. So again, we just don't know everything right now. So caution is the best.
Yeah, I agree. And you're hearing that time and again. We're here tonight on Facebook Live on NorthJersey.com, representing the Record and NorthJersey.com, with our State House reporter Ashley Balcerzak and JeanLuc Neptune, a doctor and someone who's in recovery from COVID-19 at the time. And we're answering your questions. We would also ask that you take some time and please consider supporting our journalistic efforts by visiting northjersey.com/subscribe. And it's more important than ever to keep our journalists out on the streets. And your funding, your support helps us do that. So please consider subscribing again at northjersey.com/subscribe. We have a couple of more questions in the chat that I'd like to get to. There's a question about the National Guard being deployed. And certainly if we see some pictures from Bergen Community College today, you will see that the National Guard is out there. You'll see some Humvees and folks in fatigues. And essentially they're being used to help maintain crowd control, to help with testing. They're being used in a supportive manner to help set up testing areas and help set up other things that may be needed in the future. The governor has talked about creating more hospital spaces throughout the country, or throughout the state, to handle what is an expected inflow of patients. So you will see National Guard being used to help do that. There's another question here. Can we clarify information on relief or resources for renters and landlords and homeowners? And Ashley has done some reporting on this. So I'd like to bring her back in. And what do renters and homeowners need to know at this point? We are about 10 days away from the beginning of the month when rent is typically due. What have you learned on this topic, Ashley?
So one of the biggest things that's happened, the state legislature passed a bill. Governor Murphy signed it right away. This was last night. That basically, during this period of a public health emergency, you cannot be evicted or foreclosed upon at this period of time. So in terms of actual cash relief in that sense, it's to be seen. The governor has been urging banks to kind of go easy on people with mortgage payments. So we'll see if anybody takes his advice there. There are also programs that you can see if you qualify for. If you visit nj.com/DCA, D as in dogs, C as in cat, A as in Ashley, Department of Community Affairs /DC aid, AID. There's a kind of quiz there that you can take and see if you could get certain assistance for housing. So those are important things. Also, President Trump had ordered that any HUD properties cannot evict or you can't be foreclosed upon through the end of April. So that's public housing. And we'll let you know of any other things that we learn. The governor's been asking for a lot of federal block grants and economic stimulus. He and 3 other governors in the region asked for $100 billion today from President Trump. So we'll see what we get from the federal government to try to help people economically.
Well, I think that's a big question too, is there's so much aid that's going to be needed, not only to help people get through their daily lives, but also to restart the economy, which in so many ways has taken hits. I think that it's a big worry for people as we go forward here. And the one thing that I'll say is that we're all in this together. We're all facing these fears and these anxieties and the unknown together. And it's really, an interesting time from that perspective. I don't think one of us is going to remain immune from the effects of this virus. Whether or not you contract it, I think there are, in so many ways, it's changing how we live, and it's doing it in such a rapid fashion that we will need to, I think, be patient with one another and, be objective with how we approach things. And again, operate with facts and not fear. We have another question here, and I can bring JeanLuc back about. There's a question, JeanLuc, about precautions folks might need to take if they live with someone who you had alluded to earlier might be compromised medically in some way, who might, have an underlying condition. No one may be sick in their household, but are there extra steps people should take, or is it really being vigilant about cleaning and hand washing and limiting contacts?
Yeah, I mean, I think that's, at the end of the day, that's going to be the advice for everybody and for every situation. And I think we're hearing that from a lot of health leaders. Hygiene, hygiene, hygiene. Wash your hands. Cover your face if you're sneezing. Sneeze into your elbow. Making sure that you are social distancing as much as you can, even within a household. Again, I think those are going to be the things that work the best. And it's, that's the case in a lot of public health stuff. The simplest measures can be the most effective.
And again, the purpose of all of this, folks, is so that we really do try to flatten that curve and not overwhelm our health system. We have fantastic doctors, we have a fantastic health system, but they have a limited capacity. And if suddenly, thousands and thousands of people need that urgent care, need respirators, need isolation rooms, that will be the problem. And that's what everyone is trying to solve right now. That's why these measures are being put in place, to give our health system the ability to actually combat this as it arises. And we have another question here, JL, that could work for you. What can we do now to boost our immune system? I don't know if you have any tips or tricks along those lines.
Good question. So, I come from a very traditional medical background, trained in the Columbia system. And in the world that I was trained in, there's really no concept of immune boosting. That's not something that I'm necessarily familiar with. There are clearly some strains or some thoughts around medicine that you can boost your immune system. I think the most important thing is probably to not become immune depleted by not getting enough sleep and exhausting yourself. That's probably the best advice, is to just try to make sure that you get enough rest so that you're not a setup to get some other kind of infection. Because remember, it's not just COVID season, it's still flu season, it's still cold season. We're at the beginning of allergy season now. So you really, more than anything, want to take care of yourself. And, hopefully that's enough to keep your immune system boosted and responsive.
I think that's a great spot to end our first Q&A. We've been going for a little more than a half hour. I want to take this time and thank JeanLuc Neptune, doctor and entrepreneur, for coming on. You're looking great. You're looking well.
Thanks, man.
I wish you a speedy recovery. And Balcerzak, our State House reporter, for her diligent work over the last few weeks, and what I'm sure is going to be many more weeks to come, Ashley. So get your rest. And I will do that as well. I will follow the doctor's advice and make sure I get enough sleep each night. And to all of our viewers and our readers, again, thank you for tuning into this. Thank you for reading what we write, watching what we shoot on video and in our photos, and interacting with us through our social channels and through the many emails that I receive every day from you as readers. Again, please take some time, support our efforts at northjersey.com/subscribe. We are looking to keep as many journalists as we can covering this going forward. And as you can imagine, it's a tremendous strain on the staff, who I think is doing a wonderful job and working as hard as they can to bring you the important information that you need day in, day out. Look for another Ask the Editor sometime next week. We'll get a word out to you on northjersey.com and on our Facebook page. Excuse me, I've been talking at screens for a while, social distancing, and doing a lot of telemeetings. So this has been a great half hour. I think we all learned a lot. Thank you so much for your questions, and have a good night.